Welcome to Basic Black. Some of you are joining us on our broadcast, and others of you are joining us on Facebook and Twitter. I'm Callie Crossley, host of Under the Radar 89.7. Tonight, vaccine equity. We, like you, are dealing with the effects of the coronavirus pandemic and are taking precautions. We are working with limited staff, and our guests are joining us remotely. It should have been a smooth operation, but the Massachusetts vaccine rollout has been undermined by problems with a confusing website as well as short supplies of the medicine. Left in the lurch, communities of color, who've suffered the highest rates of COVID infection and death, but make up the lowest numbers of those vaccinated. Black and Latino state lawmakers are proposing specific corrective steps in a proposed bill. Is this the key to removing the obstacles to vaccine equity and access? Joining us, State Senator Sonia Chang Diaz of the 2nd Suffolk District, which includes sections of Dorchester, Jamaica Plain, Hyde Park, Mattapan, Mission Hill, Roslindale, Roxbury, and the South End. Dr. Charles Anderson, President and CEO of the Dimmock Center in Roxbury. Representative Liz Miranda, State Representative for Suffolk County's 5th District. Her district comprises parts of Roxbury and the Dorchester neighborhoods of Boston. And Atia Martin, member of the Black Boston COVID-19 Coalition. She is also the CEO and founder of All ACEs Incorporated. Welcome to all of you. I think when people hear vaccine inequity or vaccine equity, they're kind of confused. What does that mean? So I thought, let's start with some numbers. 65% of those vaccinated in Massachusetts thus far have been white, 5% black, 4% Latino. You say, State Senator Sonia Chang Diaz, that this is a classic case of structural racism and that you could see it coming early on because of the absence of things. Explain.
Yeah, Callie, I'm so glad that you started with numbers because that is one of the key things that, myself and Miranda in the bill that we filed, the Vaccine Equity Act, and also the Vaccine Equity Now Coalition, of which Dr. Martin's a member, have been pushing for, is clarity about the benchmarks against which we are going to measure ourselves as a state and how we are going to define success. Yesterday at the oversight hearing in the legislature, we heard some step in the right direction kind of numbers about how Massachusetts is doing better than other states with respect to vaccinating our Black and Latino populations. But it reminded me a lot of the arguments that we used to hear around criminal justice reform, the arguments against doing away with mass incarceration, when people used to say, oh, we don't need to do that because, Massachusetts is better than every other state. But of course, being better than awful is still bad. Mm-hmm. And so if we have to choose the right benchmark, and what I am saying is, look, we need to benchmark ourselves to where the infection rates are the highest in Massachusetts. I think this is an intuitive measure for people that where folks are, where the most people are getting sick is where we should be putting most of our effort for vaccination.
So, Representative Liz Miranda, some people would listen to this and say, yeah, I hear you, but, if we have all boats rise, then everybody gets taken care of because that's the reason to have the mass vaccination sites, the ones in Gillette and South Boston, because then more people can get in and, that will mean that, of course, folks of color would be included in that because we're raising up all of the boats. Now, why isn't that working?
It's not working because we have a country and a commonwealth rooted deeply in structurally racist experiences that have left our communities deeply segregated, without the access to the health care that they need, living in communities that are environmentally polluted. Look, I represent the Bowdoin-Geneva corridor here. It's one of the poorest in the Commonwealth. It is also the most minority in the Commonwealth. Have you ever tried to get to even Fenway Park? Many people in my community, over 50% of my community is foreign-born, have never even been to Gillette or to Fenway Park. Transportation is an issue. And we are in the middle. And, it's hard to think that it's almost a year. In a couple weeks, we'll be a year away from when we first really heard about COVID-19. Now, we were months shy from when we wanted our then president, Trump, I'm so glad he's out of office, from really recognizing that we were in a pandemic. People have lost their jobs, they've lost housing, people have lost loved ones, and to think that they are going to go to a mass vaccination site and log on to a website where there's so much digital illiteracy in our communities, and to think that no languages that represent my community, there was no Cape Verdean Creole to start with, there was no Vietnamese. And so people were actually forced to think about, if you want to get vaccinated, you actually had to go to the other step. And the step didn't work for us. And so I hear people saying, we hear you now, but this is a life or death issue. We knew who got sick. We knew which communities were deeply impacted. And to echo the sentiment of the senator, although we failed to get the best data and dashboards are incredibly important to know who and how we can help. And so that's a major part of the bill that we filed. And I would have loved to have not had to file a bill, but I'm really proud that we did, to push the governor and the executive branch to do better for communities of color. Once we take care of the vulnerable and most marginalized, we do lift everyone up. That's the boat we need to be rowing in.
Atia Martin, you say it's not too late to pivot, but the beginning of that has to be that the governor needs to admit, frankly, that there's been a mistake. One of the core pieces of the bill that Senator Chang Diaz has proposed and Representative Liz Miranda has co-sponsored is that there be one person focused on equity solely. Why is that important?
That's important because from an emergency management and public health preparedness perspective, when you have so many different moving pieces, you need someone who is kind of coordinating across everyone, making sure that someone has the 30,000-foot view and can see how things are playing out in real time. And so from an equity perspective, that person needs to also have an equity lens where they're looking at those baseline numbers for where the disproportionate burden of cases are in our Black, Indigenous, and people of color communities, as well as in low-income communities. And so by focusing on those areas and having someone who is being intentional about that, we're able to have better impact. And to Senator Sonia Chang Diaz's point around the data, the baselining, is so important because how will we know we're making progress towards equity if we're not measuring it? Right. And so having someone being able to focus on those things is really important. And just two more quick points. One is this rising tide analogy that people like to use is problematic because we know that equity has never happened by accident. It has never happened in our history by accident. So for us, without the intentionality, we will end up right back where we are right now. And so that's why I was saying the possibilities that we still have the possibility of pivoting, and that the data, the other reason the data is so important is because the inequities that we're seeing in our communities get lost in those averages. Right? So once you start to average everything, you miss the details of where those hotspots are, even within seemingly wealthy neighborhoods. We still have low-income people and people of color across the state in these pockets who are getting overlooked because of our aggregation of data.
So, Dr. Charles Anderson, you're in one of the areas where people, and you're heading an institution where people feel they can trust. They come there regularly. The Dimick Center is a community location. It's been there 150 years. So people know it and feel they can trust. But even within your own walls, you've had to tell the story, which you say is very important that it be done, why this vaccine is important, because there is some hesitancy on communities of color. And by the way, justifiable hesitancy. We've talked about that on this show, about where that comes from, the history of that. But as you've said, it's incumbent upon the materials, the support, the programs, everybody to tell the story and make it clear to people why they should want to take the vaccine. That hasn't happened in the way that it should yet, even despite efforts like yours at the Dimick Center.
Yeah, agreed. I think what's also really an important point for me is that before you get to hesitancy, it's really about trust. It's really about confidence. So the way we think about it here is how do we actually build vaccine confidence? And we have been blessed to be where we are and have this sort of trusted relationship with the community that has allowed us to take that trust and extend that into conversations that engage people exactly where they are. And I think that's the important thing. You know, we went through this, and my background is also I'm a pediatrician, newborn intensive care doctor. And so I've lived through these eras of vaccine lack of confidence, so to speak. And what we found from those experiences, just hammering people with information about the vaccine doesn't necessarily get you there. You have to meet people where they are and allow them to tell their stories about how they gain confidence in this vaccine. And that's what we're doing here. And I think that's going to be a critical part. And to your point, there hasn't been a real coordinated effort to do that across the Commonwealth. We're trying to do our part right here in the community we serve.
Dr. Anderson, you also get your Master's of Public Health from Johns Hopkins, and Johns Hopkins has been the center nationally for all of the information, the data about how COVID is moving in communities where infections are highest or lowest, and I imagine they're engaged in the same kind of data collection with regard to the vaccine. So you know full well how important it is to have this data collection that everybody else on this panel has said is necessary. I'd like you to speak to that and what a difference it would make if there were a dashboard, if there were the kind of data collection, particularly around race and ethnicity, in place.
Well, again, my background is such that whatever you don't measure, you can't affect. Again, newborn intensive care, it's all about give me the blood gas and I can make this change. Within a company, show me what's going on. If I don't have access to the information, I can't make the changes. So it's impossible to do the work we're trying to do without good dashboards. How do you actually make course corrections in something that you're doing for the quote unquote first time without dashboards and without gauges to help you understand how you're doing? It really is impossible to do it. So it's critical. And one of the things we're doing here right now is because we're actually focusing primarily on our existing population of patients that we serve, we have the opportunity, leveraging our database, to know, are we reaching everyone who's in these various priority groups? Who are we missing, and what can we do more effectively to actually reach them?
So, more numbers. The Roxbury Bay Center, Reggie Lewis Center, opened up to offer vaccines. Initially, there was a flood of people from across the city who were mostly white. But now that's changed. According to the latest statistics, there have been 4,000 vaccinations given, and of the 4,000, 45% of those people were people of color, according to the stats that they gathered, and 55% were Boston residents, most of them from Roxbury. So, Senator Chang Diaz, is that good? Where does that put us on moving toward the equity that you think your bill could actually expedite?
Yeah, I think, again, step in the right direction. And I think it shows what is possible here. I think what a lot of times when people hear frustrations about equity, their eyes kind of glaze over and it just feels impossible. And how can we cure, 400 years of, structural racism in 3 months? But actually, the dial really does move, right? The system does respond to effort. And so I think just in the space of a couple of weeks, we've seen as folks in charge of this effort have become more laser focused on, driving attention, driving resources, and driving results in communities of color, that we're seeing those numbers go up. So just imagine what would have been possible, right, if we had started this in September with that trust building that Dr. Anderson talked about. And I wanted to return to something you said earlier, Kelly, about the rising tide lifting all boats, right? Another analogy that folks use, I think, to describe, argue that the current system is fair is to sort of think about the current system as a lottery, right? And that we're just, look, the doses are out there, they're available, and some of everybody is going to get, through that door to get those first doses. But really what we need to tell the truth about is it's not a lottery so much as a raffle. And that each advantage that different populations have, get them extra tickets into that raffle drawing. So if you have a life expectancy over 75 to begin with, you get an extra ticket, right? If you have a reliable internet connection, extra ticket. If you have lots of surplus hours in your day to spend on on the website, just clicking through and waiting to see if you get an appointment, that's like 5, 6, 7, 8 extra tickets. You have a car, you have a driver's license, you have somebody who can afford to take time off of work to take their Nana to get their shot. That's, those are all extra tickets. And that really adds up. So, are those numbers at the Reggie improvement? Absolutely. And we need to keep driving that dial further, because we should not be satisfied with 45 or 55% when this is the site, that's supposed to be in the heart of the Black and Latinx community. We still aren't seeing that reality show up in the numbers. I think we can get there with applied effort. And then just lastly, I would say, again, back to the analogy about the rising tide, it works both ways, right? Like if we really drive all of these resources and focus into the communities that have been hardest hit by COVID, and we do right by those communities, that is going to rise our tide for the whole state, because of course, Black, Latino, immigrant communities have been at that's our frontline workforce. These are the people who are taking care of our children, our elders, our nursing staff in the workforce in the hospitals. The whole state needs communities like Chelsea and East Boston and Dorchester and Mattapan to do well.
And in fact, Atia, yes, go ahead.
You're going to come right to me.
Yeah, I was coming to you.
I wanted to get on that number piece, because it's the example that was given is actually because of a community partnership with the Black Boston COVID-19 Coalition and CIC Healthcare, the vendor, the contractor that the state has funded in order to be able to do the vaccinations at that site. In our partnership with the Black Boston COVID-19 Coalition also includes the city.
Meaning the Reggie Lewis Center. You mean the Reggie
Lewis?
Yes. Okay, go ahead.
And so we've been working with the city in order to get all of the folks from our communities registered. So we have a place where folks can go onto our website, blackbostoncoalition.org, sign up. And beyond this weekend, which we have a special Black History Month event tomorrow and Sunday, where we've registered over 800 people to be able to get vaccinated just this weekend. Beyond that, we'll also be continuing to support the community in getting registered.
And I wanted to pick up from Senator Chang Diaz's point about all boats rising in the opposite direction, meaning that other communities are also put in a better position if there is targeted materials, targeted efforts toward communities with the highest risk of infection and death. And you have said that poor whites are left out in the same way, that they're the kinds of needs that are being expressed by communities of color who have been marginalized in this, poor whites have too.
Mm-hmm. Yes, so it's this idea.
Go ahead, Dr.
I'm sorry. I thought you were asking me.
I was asking Atia, yes. Yeah.
So, the opportunity that we have that we're missing here is that when you focus on priority populations, people who are already marginalized in society, underestimated in society, you design differently. You design in ways that help to meet those, the range of needs, whether it's language access, whether it's transportation support, whether it's mobile vaccination so that people who can't get to these sites can get access. So the whole range of ways that we customize our approaches to meet the needs of various communities. And that includes poor people, which includes poor white people. Okay. And so the marginalization of people happens when we try to create policies and systems that are one-size-fits-all solutions. There is no one-size-fits-all solution. So in absence of our intentionality, we end up perpetuating inequities across the whole spectrum of people who are already marginalized in our society.
Representative Miranda, one of the pieces that you all would like to push forward is a mobile vaccination so it can get right to people, speaking of where they live. And I should mention that, this is an issue that's personal for you, too. You've lost family members because of this horrible pandemic. So it's not, you're representing people who are being marginalized for this very important medicine, but this has meaning for you doubly.
Yeah, thank you for honoring that. I lost my beloved grandmother in April of last year when over 20 members of my family got COVID-19 early on. She had a bunch of false negatives, and in 5 days went from a healthy 84-year-old and being gone. And that's, I saw in my community, it almost seemed like every day on Facebook, we would hear about people's abuelas, vovos, and grandfathers. And actually, a demographic that we haven't talked about were Black men and women in their 40s and 50s. I saw many families losing people suddenly that they didn't even know were sick. And let me just make it clear on a couple of things that we've talked about. Differently abled people are also marginalized. This is a community. This is why mobile vaccinations also really matter. Not everyone in our society can actually get out of their homes or in the congregate care that they're in. I work a lot in the DOC system, and we have a situation where thousands of people, many of them of color, are in our prisons, and they are not getting, they didn't get the COVID needs that they need quickly. You have the correctional officers who have only vaccinated themselves at the rate of 50%. And they're going back to their families and going back into our prisons and impacting and infecting our loved ones. We have a different reality to the points that everyone has shared today, that when you're thinking about fairness, this has never been fair for our communities. We have always been challenged by our public health outcomes that have been determined by policies that have been rooted deeply in racism. And one of the pieces of the bill that I think has been lost a little bit is the reason why something like the Black Boston COVID Coalition works is we know our communities. We are enough. We are worthy. We are brilliant. We have all the providers here. We know what to do in Roxbury and Dorchester. A week ago or 2 weeks ago, I found out about a site in my community, in the Bowdoin-Geneva corridor, that was only open to Beth Israel patients at a church that isn't really utilized in my community. And that is one of the poorest corridors. And to think that my neighbors or my constituents couldn't walk to that facility to get a vaccination because it was only set aside for a certain number of patients was deeply disturbing. And I was like, I didn't even get a call. It almost seems like this erasure of understanding our communities is something that is led, and we can't be forgiving. And, when Senator Sonia says it's a step in the right direction, this is a moment of clarity for us to be able to say we didn't do this right and acknowledge that and be able to pivot. But if you do not pivot rooted in trust and truth, you're actually denying the fact that you actually did something wrong. And as a government official, I'll be the first to tell you that we must be held accountable for when we don't do the right things right. And I'm hoping that we, a lot of our bill has been implemented already. And I'm happy to say that that's happened, but that's been at the erasure of the 4 women who actually took the steps to write this equity bill in the first place. And I just want to acknowledge also Representatives Dom and Senator Rausch for being our partners in this, because we have to work together all across the Commonwealth to make sure that there is vaccine equity, not vaccine equality. And that's an important piece that equity actually invests in those that need it the most.
So, Dr. Anderson, I want you to pick up a couple of things that have been said. I do want you to address the importance that mobile vaccination, mobile buses offering the vaccination could mean for a lot of these communities and could help to bring up the equity as has been expressed. But I also want to go back to something that Representative Miranda has said about those people in their 40s getting the disease and dying, because you're quite concerned that a number of people, many folks of color, are putting off health care in the middle of this pandemic, which makes them doubly vulnerable to this pandemic, because we're already at one level and then putting off the care and now concerned about the vaccine. I mean, we're just this is a very dangerous place for so many folks of color. Please explain.
Yeah, no, I'm glad you asked. It's so important to remember we're deep in the middle of this pandemic, and appropriately, that's where we're devoting most of our resources and energy, including on our 9-acre campus here. That's where our primary focus is. The reality, though, is if you look at the studies, it's very clear that roughly a third of individuals with chronic illnesses have delayed some element of their care during this time period. Most of those are individuals with complex medical conditions. We're seeing it in some of the indicators when we start to look at what's happening with hemoglobin A1C management, hypertension management. By delaying all of those things during this time period, we know that coming out of this, we're going to actually see a significant need, increased need for the type of resources that we were already struggling with to secure, to provide the care that we're trying to provide in a community that's been so significantly disadvantaged. So understanding that, I'm very, very concerned and passionate about making sure that we don't take our eye off of what sunk the Titanic, which was what was beneath the water that you couldn't see, by just focusing on the tip of the iceberg. Now, that said, let me link that to mobile and the idea that, or the reminder that this is not anything new. I think many of us are familiar with the family band. And I still remember when Dr. Nancy Orio and my good friend Cheryl Dorsey got that started, must have been a couple of decades ago. And this basic premise that if you can bring services to someone's door, you make it not only accessible, but you make it approachable, right? And we have all seen you can have an amazing hospital in the middle of a community and have that community have some of the worst health outcomes. So there's something to this idea of having people on a mobile unit who look like the people that they're serving, knocking on people's doors, engaging in conversation in a safe space, right? It's the whole idea of I'm coming to your house as opposed to having you have to come to my house.
All right. That's a great place for us to leave it right now. We're going to continue this conversation on the other side. But right now, that's the end of our broadcast and the end of our show. Thanks to all of my guests, and thank you for joining us. And stay with us as we continue our conversation on Facebook and Twitter.